Total intensive care unit beds in the United States. The statement is ICU beds are at capacity. The question should be, how many ICU beds are there? When the mainstream news media reports that ICU beds in various states are at capacity, it would be reasonable and important to know how many ICU beds are in each state and the aggregate in the United States. This information is difficult to find. The American Hospital Association states that ICU beds are not summed. Fast facts on U.S. hospitals 2021. Total intensive care beds are not summed because the care provided is specialized. Fast facts will be updated with fiscal year 2019 ICU bed counts in February 2021. The American Hospital Association's latest data is from 2018. From this, we can extrapolate that the number of beds has not increased dramatically from 2018 to 2021. There is another organization, the Society of Critical Care Medicine, SCCM, that revised a publication entitled United States Resource Availability for Virus that provides the most current statistics on total beds available in the United States, that is, all hospitals combined. The Society of Critical Care Medicine, the intensive care professionals, United States Resource Availability for Current Virus, revised 5/12/2020. This is an excerpt from the SCCM, United States Resource Availability for Current Virus. The comparison of U.S. critical care bed numbers with those of other countries. The United States has a significant number of critical care beds per capita compared to other countries in Figure 1. Figure 1 is the countries with the most critical care beds per capita. The note at the bottom on mechanical ventilators. Reports from ICUs worldwide suggest that the most common reason for the current virus patient admission to the ICU is severe hypoxic respiratory failure. Many of these patients require mechanical ventilation. To the point on page 10 of the AHA 2018 data, there were 5,256 hospitals surveyed. 1,280 hospitals did not respond to the survey. 3,976 hospitals responded to the survey. 1,253 hospitals had no ICU beds. 19 hospitals had less than 10 acute care beds. These could be used to supplement ICU beds. And 2,704 hospitals had greater than 10 acute care beds and greater than 1 ICU bed. First witness, the 2018 AHA data. To the point on page 11. Total number of ICU beds was reported to be 96,596 total beds in the United States, comprised by the bracketed information for the number of ICU beds by unit type, which are medical, surgical, 46,795 beds, cardiac, 14,445 beds, other, 7,318 beds, pediatric, 5,137 beds, and neonatal, 22,901 beds. And the notes at the bottom for A, acute care hospital beds include general medical and surgical adult, pediatric, obstetric, neonatal, intermediate, ICU, step down, and burn beds, rehabilitation, alcohol, drug abuse or dependency, psychiatric, skilled nursing facility, intermediate nursing, and other long-term beds are excluded. B, units refers to the number of hospitals reporting more than one bed per ICU type. Each hospital can have a maximum of 5 AHA designated ICU types. C, burn and other special care beds, observation, step down, progressive, are not commonly counted in the ICU bed totals. The second witness, ICU beds by state, dated 8/12/2021. This is by Benefits Pro, 10 states where the current virus has filled the most hospital ICU beds. For a look at the 10 states with the worst virus adult ICU bed occupancy percentages, see the slideshow above. For the virus and overall occupancy rates for all 50 states and the District of Columbia, see the chart below. The chart is inserted on the right. By state, you'll see a list of the ICU beds and the percentage of occupancy by the virus patients. The total number of beds reported is to be 82,526 total ICU beds reported in the United States. The facts. The New York Times reported that the current death rate as of 10/1/2020 is 700,429 deaths in the United States. There are 96,596 total ICU beds reported in the United States, and this is using the highest of the two comparisons. Note the survival rate, those that do not die. The worldwide population is 7.7 billion. The number of deaths reported is 4,786,203. The death rate is 0.06% with a survival rate of 99.9994%. The U.S. population is 332 million. Death rate is 700,429. The percentage of death rate is 0.21%. The survival rate is 99.9979%. Understand this. There's not one hospital in any city that can handle a mass casualty event because the number of beds are finite and very low compared to its local population. That being the case, what you have discovered is that the total number of beds nationally are very low compared to the United States population and could never handle a mass casualty event. It would not be an extraordinary circumstance if all of the 95,596 ICU beds were used at one time. Also consider that not all of the reported 700,429 pestilence deaths occurred in hospitals. Understand also, the pestilence is real, but it is not as severe or drastic as has been publicized, at least not yet. It is up to the Most High whether this pestilence will increase in severity, or by another pestilence, or by a multitude of pestilences. Psalm 68:20. He that is our God is the God of salvation, and unto God the Lord belong the issues from death. So those that die are because the Most High ordained it. Jeremiah chapter 4, verses 3 and 7. For thus saith the Lord to the men of Judah and Jerusalem, the lion is come up from his thicket, and the destroyer of the Gentiles or heathen is on his way. He is gone forth from his place to make thy land desolate, and thy cities shall be laid waste without an inhabitant. What you must do is fear and trust in the Most High. The Most High is in control of all those that do righteousness and all those that do evil. Ecclesiasticus 5:15. Be not ignorant of anything, in a great matter or a small. Job 12:16. With him is strength and wisdom. The deceived and the deceiver are his. Isaiah 54:16. Behold, I have created the smith that bloweth the coals in the fire, and that bringeth forth an instrument for his work, and I have created the waster to destroy. Romans 9:22. What if God, willing to show his wrath and to make his power known, endured with much long suffering the vessels of wrath fitted to destruction? 2 Thessalonians 2:3. Let no man deceive you by any means, for that day shall not come except there come a falling away first, and that man of sin be revealed, the son of perdition or destruction. These verses speak of men and women that are used to fulfill the will of the Most High.